When heading into the doctor's office or hospital, a lot of us dread the bill that follows.
With thousands of Americans dealing with some sort of medical debt, state lawmakers are taking a closer look at Maine's healthcare system and introducing legislation that could ease that burden. Caroline LaCour joins us now with more on what lawmakers are calling for. Caroline?
Hey, Chris and Zach, yeah, it's an unfortunate reality that many Mainers face, either seeking that medical attention at the risk of going further into debt or pushing it off for your finances. Now, I just got back from a news conference held by state lawmakers and consumer experts who are backing two bills that might be able to make that choice a little easier.
I can't even begin to tell you what medical debt has done to people I love and my own family.
Patricia Kidder has had medical debt hanging over her head for almost 30 years after her husband fell ill, and she's been struggling to repay ever since.
We ended up having to go bankrupt in '97. I don't want to see families have to go through that.
To make sure no Mainer has to choose between financial freedom and a doctor's visit, lawmakers are introducing two bills to tackle medical debt in the state.
This is debt that just sneaks up on you, and it can strike at any time, and it can put you in a really bad place.
Introduced by Senator Mike Tipping, LD 2115, if passed, would restrict how medical providers sell or transfer debt to collectors.
It would make sure that before a provider sells that debt, they would have to offer it at the same rate, that much lower rate that they're already getting, to the patient themselves.
According to the nonprofit Consumers for Affordable Health Care, almost half of Mainers right now are carrying medical debt, much of which stems from unexpected health problems.
When we're in the hospital, we're there to get treatment and get well and go home. We're not thinking about filling out a lot of papers to apply for financial assistance.
Medical credit cards are another side of the same coin, one that Senator President Troy Jackson hopes to tackle with a second bill.
The proposal puts consumer protections in place to ensure that patients don't unknowingly enter into predatory and unnecessary medical credit debt.
If passed, the bill would also prevent providers from filling out a medical credit card application on behalf of a patient. Providers would also have to check if patients are eligible for charity care before accepting payment through a medical credit card.
It shows that medical debt is really a threat to household financial stability.
According to a medical debt survey from the nonprofit KFF, 1 in 7 people in the U.S. were denied medical care because of unpaid medical bills in 2022. Folks at Thursday's news conference say they hope lawmakers will understand the damage debt can create for families.
Healthcare is a human right. This is just one step.
Chuck Bell of Consumer Reports, who was at this morning's conference, also noted the Consumer Financial Protection Bureau is planning on announcing a ban of the reporting of medical debt to credit bureaus nationwide, a move that might alleviate many Americans. Chris, Zach.
All right, Caroline, thanks so much.